Well, hello, everybody. I am so excited to see you here. Hang on just a second, and I will turn on my video so you can see that there's a human on the other side of this. Well, welcome this evening. I'm so glad you came. Now, here's how tonight's going to work. I'm going to be here, obviously, as a real live human this time. You're welcome to ask any questions that you have. Now, this is just our first night together because we're going to be together tomorrow night and the next night, which is Wednesday. All of these are going to be recorded, so we'll also put those up for you if there's anything you want to go back and take a look at. And remember, this is an absolutely judgment-free zone. You're here because we want to help you get ready for the NCLEX. So don't worry about if you didn't make it through all the stuff today. No judgment. No worries. I'm just glad you're here either live with me now or you're watching this later recorded. Now you'll see in the chat, you're welcome to put a question there. Also, you have my email address, so you can email me any questions that you have. Now, I promise you, if I don't know the answer, I won't make it up. I have it's more than 17 years experience helping students, over 4,000, no, actually, I just know that I'm over 5,000 now of working with nursing students who are my favorite people on the planet. So I'm here to help you. That's what we're going to do tonight. And I'm going to give you my best tips. Now, I'm pretty sure you don't like pharmacology. I love it, right? It's one of my favorites, and I've taught it for a really long time, but I totally get it if it's not your favorite. So I want to roll through some ways to really help you get ready for this part of the NCLEX. Now, I want to stress this is part of the NCLEX, right? It's not the whole deal, but it's usually one that students are kind of dreading the most. So let's roll through some of these things that we can help you with to get you started. Now, I said that it's part of the NCLEX, and I know that you're probably overly familiar with what the NCLEX Blueprint looks like, but I wanted to lay this out for you just so you can see it. Now, as an overview, I'm sure you've heard this before, but there's 4 main parts, right? Safe and effective care environment, health promotion and maintenance, psychosocial integrity, and then the giant one, physiological integrity. Now you'll see that Pharm is actually part of physiological integrity. Okay, so look at these percentages. Now you see how they kind of all fall out. Pharm says 12 to 18%. So you may see some people that say, well, Pharm will be about 15%. That's because you have plus or minus 3%. So if you've heard the story that someone said, oh, my whole NCLEX was Pharm, or my whole NCLEX was women's health, or no, everybody's test matches this blueprint. So while it may emotionally feel like that to them, it really wasn't. But here's something I'm going to tell you about Pharm. Drug names don't only show up in the Pharm section of the test. Okay, so you're going to see drug names pop up in lots of other categories. So don't panic and don't think, oh, I'm seeing a lot of drug names. That must mean I'm not doing well. That's not true at all. So just prepare yourself. I want to give you some mental strategies because what I am passionate about is how our brains work, and I am a worrier. Like, I think ahead of things that I should worry about. Most of the stuff I worry about never happens, but I am a natural worrier by nature. So I have to be very intentional to not let that hijack my brain. Of all the students that I've worked with, the ones that have struggled the most, it hasn't been a content problem. It's been a mind problem. It's the things that they let creep into their thoughts when they're getting ready to take the test. And so that's what I want to help you not fall victim to. Okay, so we've got this slide here. So you see that, yeah, you're right. Pharm is a big chunk of your test, and it will show up in other categories. So usually students want to know, excuse me, but is there a drug list for all the drugs that will be on the NCLEX exam? And the answer is no, there's not. So what we do is, those of us that are experts in teaching pharmacology kind of put our heads together and figured out what are the most likely types of drugs? And that's how we built this course. Okay. I built this course so that you would have a good shot at the overall best guess of concepts that could be on the NCLEX. Does anyone know exactly? No, because everyone's test is different. And there is no official, these are the only drugs that will be on the NCLEX. But relax, because I've got a good answer for you. I promise. So while I can't promise you'll know every drug name, in fact, I have a bit of a different story for you. Here's the good news tonight. Now, I'm sure you recognize this little figure. If you don't, that is how to Elsa that or let it go. Okay, so two things I want you to take out of tonight. First of all, I'm going to give you on day 3 a study stack tool that you can use on your phone. Now, I've picked about 300 drugs that I want you to be kind of familiar with. If you're really serious about pharm and getting ready to go on that, have it on your phone every day. Just go through 10 to 15 questions. Keep doing that on a regular basis where you're going over those drug names and some side effects. And I've got some key points in there for you. And tell yourself, I've got to cut it off here because there are other drugs. Yeah, there's lots of other drugs, but there's other content that's just as important in the NCLEX for you to be reviewing and studying. So we don't want you to get hyper focused on pharmacology. So first thing, I'm going to give you a tool where you and I can agree, listen, I'm just going to look at these drugs and keep reviewing those in addition to the pharm handout for this NCLEX review, but those drugs are on there, I promise. Now, the second thing is I want you to anticipate that you are going to see something totally foreign to you on the NCLEX. I mean, you'll be like, did I go to nursing school? I don't recognize this drug. I don't recognize this diagnosis. I don't recognize this disease. What I want you to tell yourself, which I even use that term in my brain, Rhonda, Elsa that. That's what I say, because thinking about it and worrying about it and getting stuck on it doesn't help me do better on the test. So tell yourself, I knew this would happen. It's not the end of the world. I'm going to Elsa that, do my very best to answer this question, and I'm going to go on. It's just one question. Because see, the students that I know that really get into trouble, that go all the way to the end and struggle and really have a difficult time with it. Again, it's never a content issue. It is managing your anxiety and your stress and your test experience. Now, there are certain schools when students would come to me, because that's one of the things I do is a way to give back is to help students that have struggled on the NCLEX. And there's a couple schools that have since been shut down. So I would ask them first if they went to these schools that shall remain unnamed. And if they went there, I said, okay, you have a content problem. Your program is really not providing you with the content that you need, but those schools don't stay open. You're graduating from a reputable school. You've got a lot of content in your brain. I'm just going to help you use it and organize it, because how you put that information in your brain is the solution to how you get it back out when you need it, whether that's on the NCLEX or, more importantly, when you're actually taking care of patients. Okay, so what have we learned so far? Yep, pharm is going to be a relatively big chunk of the NCLEX, and it's going to show up in other questions. Second thing, man, you got to learn how to control those thoughts that become negative so very quickly. So you got to Elsa that, anticipate there's going to be something you don't know, and limit what you're going to study, and according to pharmacology, getting ready for the NCLEX. So let's talk about how you do that. I hate when people want to give me advice, but they don't give me practical steps on how to do that. Now, there are 4 million side effects. Remember what it felt like when you took your pharmacology course? Holy moly, it was terrible, because the pharm textbooks are always this thick and there's 4 million side effects for everyone and it's just overwhelming. Then you want to give up. Don't do it, okay? Think about this strategy. Hopefully you've already did this when you were in nursing school, but learn the side effects as a family. So think about them as a category or as as a big family unit. So I don't learn the side effects for every individual ACE inhibitor or every individual beta blocker or every individual antipsychotic. What I start thinking are, hey, what are the biggest risks? What are the things that puts my patient safety most at risk? Well, with ACE inhibitors, I told you in this, we'll go over the cardiovascular drugs, but I remember 3 things specifically for ACE inhibitors, and they start with the letter A, the letter C, and the letter E. Now, the letter A is for edema. That's right, edema, because ACE inhibitors can cause swelling of my mucous membranes in here. That's going to be a breathing problem. Anything that gives me a breathing problem, that's a big deal. Now, C is for cough. Yep, cough. And E is for elevated potassium. So I know I'm going to think about, as a family, ACE inhibitors. That's all I got room for in my brain, right? That's all I have room for in my brain. Is there something else? Yes, there's thousands of other things, but I can't keep all of that in my brain. But what if I get an ACE inhibitor question? It's something else I didn't know it. I'm going to ELSA that because I'm doing the very best that I can. But what I have in my brain, I know very well, and I'm confident in it. That's one of the secrets. Now, beta blockers, you know that slows your heart rate down, right? So the biggest risk is, I don't want to give that to somebody whose heart rate is less than 60. Right. That's the magic number in NCLEX world. Now, in real life, cardiologists will crank those heart rates down much lower than 60, but in NCLEX world, everything is perfect. So normal heart rate is 60 beats to 100 beats. So beta blockers, I don't want to give it to somebody whose heart rate is already too low, but remember beta blockers and breathing problems, because if that beta blocker also starts blocking the beta receptors on my lungs, whose jobs are to bronchodilate when I need more oxygen, that's bad news. So beta blockers and breathing problems, bad news. Whether it's a cardioselective one or a non-cardioselective one, beta blockers and breathing problems, real bad news. Now remember, ACE inhibitors end in pril, beta blockers end in olols, generally. Is that 100% every time? No. But you're playing a game here when you're taking the NCLEX where you're making your best educated guess, right? Now the last one, antipsychotics. What about an antipsychotic could kill you? Yeah. Neuroleptic malignant syndrome, right? That's the lead pipe rigidity. They're eventually going to die of respiratory failure if we don't help them. So knowing antipsychotics as a family or a category, then I tick through my brain, hey, is there any way this could cause significant harm to my patient? Oh, there is antipsychotics. That's got that neuroleptic malignant syndrome. So will the angry South Pole elves who write the NCLEX, that's what I like to call them, because Elf is my favorite movie ever. And I love that scene where he goes, ooh, he's an angry South Pole elf, because I think of people that have to write those questions as angry South Pole elves. These guys aren't going to ask you, which of the following drugs are going to cause neuroleptic malignant syndrome? They're going to expect you to be able to recognize what neuroleptic malignant syndrome would look like. Stiff extremities, arched back, sweating, vital signs going up and up and up. They're going to expect you to know that is the type of recognizing that your patient is in trouble. Because when it comes to medications, they're looking for, do you recognize if a medication is safe, if the patient should get it, if it's effective, or if the patient is experiencing any nasty side effects. So just think about the side effects that are the most severe or organ damaging, right? That's why I gave you a list of those to have those in your packet. So look for the ones that are most severe, like neuroleptic malignant syndrome with ACE inhibitors, angioedema, cough, elevated potassium, beta blockers, too slow, or breathing problems are going to be a big deal. And then look at the drugs with the organs that they take out. Now, when you're looking at your packet, you'll see that little icon up there. It's like a 60-second overview. You guys have already had pharmacology content. So this is just a ding, 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 ding. This is a reminder. This is high yield content saying like, this is a no-brainer, okay? These are the minimum things you need to know to be ready to take your pharm section of your NCLEX exam. Okay, so watch for that. Make sure that you see it. Now, let's start getting into any question. Pharm question, physiological adaptation question, any question. The NCLEX questions are a little different than what you had in nursing school. All of them have gone through ridiculously intense and rigorous statistical review. We just don't have that kind of time or money in nursing school to run this kind of practice or testing of individual test item questions. The NCBSN, the angry elves that write your test, they do. And they're very precise about putting questions in your exam, looking at the statistics, because when COVID first, remember we shut down the NCBSN, all the testing centers, the peer testing centers. Then they reopened them, but they took out the practice questions. Now the practice questions have been added back in. That means 15 questions of every NCLEX exam don't count. Sadly, you don't get to know which 15, right? But when they come up, you do your best, just like any other question, because you won't know. But those are questions that they're running through students just to see if they're accurate, if there's any confusion, if they should be double keyed, or honestly, if they're not tough enough. If the wrong answers don't catch enough people, then they'll know that those distractors need to be rewritten. So this is a really important concept I want you to get. When you are trying to learn information, I want you to always ask yourself, why would a nurse need to know this? How would it keep a patient safe? Let's go back to ACE inhibitors. Why would a nurse need to know that ACE inhibitors can cause elevated potassium? Well, I may see it in a question that says, hey, which of the following, your patient is on an ACE inhibitor, your patient's on Gavtopril, which of the following healthcare provider orders would it be most important for the nurse to question? You look through the orders and notice, there's an order for a potassium-sparing diuretic. Well, I know ACE inhibitors raise your potassium. I know potassium-sparing diuretic can technically raise it because it's definitely not going to lower it. So that would be the order for me to question. So how would I keep a patient safe? I would know not to give a potassium-sparing diuretic until I checked with the healthcare provider. It may be fine based on that patient's unique needs, but those are the things you're looking for. Think about beta blockers. Why would a nurse need to know about beta blockers and the beta receptors on your lungs being blocked? Because you may see a question that says, which of the following statements is it most important or requires immediate follow-up with the client? Well, if you know the patient's on a beta blocker and he says, I find myself shorter of breath than normal, they're seeing, do you recognize that a risk of beta blockers is breathing problems? And did you pick up that's what the patient is communicating to you? So it won't necessarily say, I believe I am inefficiently bronchodilating when I need more oxygen in my PaO2. It won't say that. They'll look for patient statements and they want to know, do you recognize that this patient is starting to get into trouble because of the treatment that we are giving them? Because it is all about patient safety first, okay? So let's pause here for just a moment. I promise you, what I'm going to go over with you next is critically important, and you starting to prioritize. Oh, that's an ugly word, isn't it? Prioritizing. That means when you see an NCLEX question, there's 4 answers and all 4 of them could be right. And that is so annoying because it will ask you what's most important, what requires immediate follow-up, what is the most effective. So they're going to ask you to prioritize. So I've got to do this right away. Namaste. Tell yourself you can rage against the screen, bang your head against your laptop. It's not going to change anything. You're going to have questions on the NCLEX with multiple correct answers or all of the answers are correct. And they're asking you to prioritize. Do you recognize what's the most important thing to do? Now, when it comes to safety, we'll talk a little bit more about that, but I want you to first really let this concept settle in. Of course, in real life, you don't want to hurt a patient, but in NCLEX testing and in test questions, you always want to be aware of patient safety. Now, I call these the particulars. Okay, so this is a clue and this is some strategies on how you can start ripping apart test questions to really help you. So we know for this particular patient in this particular setting, what keeps them the safest? I want you to ask yourself that question on every question, okay? For this particular patient in this particular setting, what keeps them the safest? Okay, now I know that may sound strange, but I promise you it's super effective. Remember, you're already thinking when you're putting stuff in your brain, why do I need to know this? How does this keep a patient safe? You could also add, how could an angry NCLEX self ask me this question? Yeah, when you do that, it works too. But for this particular patient in this particular setting, what keeps them the safest? Now let's talk about what's particular about a patient. Well, it might be their age. Whenever you see an age in a question, wow, pay attention. It might be a pediatric age, it might be an elderly age, it might be middle age, it might be an adolescent, but your mind automatically has to go to, whoa, what is specific about this age? Is this a developmental question? Developmental questions can include everything from birth to death. Okay, so developmental stages go all the way from birth to death, but we do things differently. Let me also give you an example. If we're worried about safety, you know that toddlers, what's the worst thing they do? They put everything in their mouth, right? So choking is a big risk for them. We have patients who are adolescents, let's say adolescent males. They sometimes can be prone to risky behaviors because they think they're invincible, right? So they may ask you a question that has to do with age. It may be developmental and also maybe an indication, excuse me, it also may be an indication that we use with our elderly population. So if it's about a medication and the patient is older, we know they are going to be more sensitive to the medication. Pretty much at both ends of the spectrum. Our really, really little guys, our babies and our pediatric patients and our elderly patients, they're just more sensitive. See, our newborns, their organ systems are just revving up. They're immature. Our elderly patients, theirs are wearing out. So either way, they don't function like a middle-aged adult patients would. Also, with our elderly population, they're going to be more very fragile with fluid volume overload, as will our tiniest of patients. So age really matters. You answer questions differently. And when there's an age in the question, pay attention. See how it impacts that question. What about vital signs? Okay, anytime you see a number, so if you see a vital sign or a lab work is something else we could add to this. But if you see a vital sign or lab work, you ask yourself these three things. Is that number high? Is that number low? Is that number normal? Okay, why do we have to do that? Because trust me, the number one thing most everyone does that sets them up for failure on NCLEX, besides letting your mind go south, is reading the question too quickly, not taking the time in the stem of the question to really make sure you understand, you know what it's asking. So by forcing yourself to make a call on vital signs or lab work, you're saying, is this high, low, or normal? If it's abnormal lab work, man, we need to do something. If it's an abnormal vital sign, we need to do something. Sometimes the answer is just document, and that's okay when it's normal. If it's abnormal, that's not going to be your best choice. If it's a diagnosis or a procedure, I'll go over with you in our next coming days how to do the fast forward or the worst case scenario method. So keep coming back and we'll go over that. Medications, you're thinking about, those can change the question, right? If I've got somebody who's on a beta blocker and they're an elderly person and their heart rate is 45 and they start to tell me they're feeling really dizzy and shaky, I'm concerned. If I've got a 32-year-old marathon runner whose heart rate is 45, his blood pressure is fine, he has no symptoms, I'm not worried about it, right? So medications can change it. Gender, symptoms, assessment information, these things that are particular, these are cues and clues those angry elves are sending you. You just have to pay attention. I promise you, you have the knowledge that you need. You just need to not get tripped up by going through the question too quickly. So we talked about safety being the most important construct. And what's particular about the patient? That's this. What's particular about the setting? Any one of these. See, I'm going to respond differently, inpatient, outpatient. If they're at home and they're calling me on the phone, if I'm at a school, if I'm in a mall doing a health screening, if I'm in intensive care, if I'm in ER, I'm on a field trip with a kid, I'm going to respond differently. I've got more tools, more drugs at my disposal in an inpatient setting or in an ICU or an ER than I do on a field trip or on the playground. So remember, for this particular patient, you saw all those things, right? In this particular setting, there we go. What keeps them the safest? That's what I want you to focus on. So please write this down if you don't mind. For this particular patient in this particular setting, what keeps them the safest is the focus of what you want to be looking at. All right, we'll go over more of this because we're going to do some more questions. Now, this is what we looked at today. So kind of how does this play out? Well, you took a pretest, right? And I promise as we go through all the videos, we'll break each one of those questions down to kind of give you a feel for how they could look on an NCLEX exam. Now, I gave you ototoxic drugs, drugs that go after your ears, nephrotoxic drugs, drugs that go after your kidneys, hepatotoxic drugs, liver. I think you knew that. We talked about some of those same study tips that we went over tonight. I hit some cancer chemotherapy. And I want to make sure you remember how that chemotherapy we talked about worked. It's the cytotoxic, the cell killer drugs. And those are the ones that we really focused on because I'm thinking that could be a really high likelihood if you see a chemo drug, that may be what you see. Now, can you memorize every one of those ototoxic, nephrotoxic, I don't think so. Just do your best. All right. Let me tell you, if someone hasn't told you today, you are enough. Give it your best. And I've told your other peers, if you need help writing out a study plan, I would consider it a privilege to help you do that. So let's look at this question. Okay, so nurse assesses the client receiving cisplatin. Which question is it most important for the nurse to ask? Okay, well, I know for this particular patient in this particular setting, what keeps them the safest? So what's particular about this client? I don't know age. I don't know. All I know is they're getting cisplatin and they're asking me which question is the most important for me to ask. Well, that means which of these questions will keep my patient the safest. So you have to think back, do I know what cisplatin is? Let's say you had no idea. Okay, I just have to ask myself, all these are questions. They have 4 questions for me to look at. So I have to ask myself, which one of these questions is going to give me the best information to keep this particular patient the safest? Well, I'm going to do this question like, I have no idea what cisplatin is. So A would be asking, do I think it's going to damage your hearing, right? Well, I don't know. What about, do you awaken often during the night? That's an odd question. I might be getting up to have to go to the bathroom, or I don't know, that's pretty vague. Is there swelling in your feet or legs? Ooh, that means it could cause a type of failure or edema, because I know calcium channel blockers can do that too. And are you experiencing any joint pain? Well, if I truly have no idea what cisplatin is, then I have to tell myself, it's okay. I knew this would happen. I knew a drug would come up on the test. I am not going to let myself get all worked up about this. I'm going to have to pick one. So I'm going to pick what I think is the most educated one. I'm going to eliminate B, C, and D, and I'm going to just go with A because it's ototoxic, but I have no idea. Well, that does happen to be the answer. You know that now. But cisplatin is a cytotoxic. It's a chemotherapy drug, but it also has a side effect, an adverse effect of ototoxicity. Now, here's a couple things here. 1, if you didn't know the drug, I want you to practice not beating up on yourself. 2, now you've seen this, you know that cisplatin is ototoxic. Write that in your NCLEX notebook and just keep reviewing that as you go over your notes on a regular basis. Then you won't let that one trip you up on the NCLEX. But be prepared. There's going to be things that you may not know on NCLEX. Why do I keep saying that? Because no matter how many times I say it, it's still really stressful when it happens to you. Now, these are the drugs I listed for you for bad for your liver, but I wanted to put this down here at the bottom where it says watch for, because these are ways the angry else can assess if you recognize when a patient's liver is struggling, whether it is a pharmacology question or it's just a question about liver failure or cirrhosis or hepatitis, any of those things. So these are the kind of vague symptoms that go with liver problems. They're really tired, they're weak, they're not hungry, because remember, your liver, everything I eat it goes down to my gut, gets shot back up through that mesenteric vein system back up to my liver to be processed. And so if my liver's suffering, I'm usually not feeling very good. I've got pain, dark colored urine, yellowing of my skin and eyes. I look like a pumpkin. Yeah, not good. Liver enzymes, those are going to be elevated. Keep in mind, ALT is more specific for liver damage than AST. So L is for liver and for ALT. Now, sad news for you guys, but it's just a tiny bit sad, not like super sad, because people that take the next gen NCLEX and they think it may start about 2023, they don't have to know lab values. They're going to put them right in the question. You guys, however, you have to know lab values. So keep practicing knowing those regular, normal lab values. Here's my advice on lab values. Like, should I relearn them? No. If you already learned lab values in school, remember how you discovered that like one textbook was different than that textbook, was different than that textbook? Yeah. Again, Elsa, that. Stick with a mid-range. They're not going to try and just barely hit you around the edge there. It's going to be fairly evident what it is. Now, why do I say it's tiny bad news? Well, because those that are taking the next gen NCLEX are going to have a whole new format that you don't have to take before 2023. So yes, you need to learn lab values because those are kind of no-brainers that they could be on the test, but you don't have to take the next gen before 2023. So I put this slide in here too to remind you to study as you go. The best way to prepare for NCLEX is as you're going through things. Don't tell yourself is what we often do. Ooh, I'm just going to study twice as hard tomorrow. You really need a plan, okay? You need to keep in mind small study periods every day, and I'll give you some tips on that tomorrow, are more important than intense cram sessions. Your brain needs downtime to process that information. So when you see things like this told you, hey, these are the things that we're going to cover in this course. And if you can hang with us and if you can keep up every 3 days, you're a rock star. If you don't, no judgment. This is a judgment-free zone. But thinking about your patient in system by system is another pretty structured way to put things into your brain and to try to tell yourself, I've got this. I've got a hold of this. And I'll go over more of that as we go through. But when you see something in the session that says, hey, stop for a minute and write this down, please do it. Not because I'm trying to tell you what to do, but because if you will study as you go, you're reinforcing that information, moving it from your working memory to your long-term memory. And that's what you want, because when you make it to your long-term memory, you can pull it back. Like, remember we talked about this high growth fraction cell thing? I did some silly things in there because I said like hair, GI, skin, reproductive, and bone marrow. Now I know that sounds silly, but I don't care. I'll do anything to help you be successful on the NCLEX. However, that goofy stuff, something that twists it up just a little bit, helps it stick in your brain. But look what I did. I went from top to bottom. That's putting information in my head in a systematic and orderly way. Now, you know from doing this that likely the questions will come from number 2 and number 5, right? GI tract question, nausea, vomiting, stomatitis, bone marrow, low red, white, and platelet cells. So that's likely where the questions will come from, and that you always want to assess your patient. But when I need to commit a list like this so that I understand it, I look for ways to do that. I'll go from top to bottom. Then I'll start with number 3 and go down and work my way upward again. Come at information from different angles. Please don't study in the same place every time. Change it up, move it around, do things. When you start to feel yourself get kind of bored, I'll show you some strategies tomorrow on how you can keep your brain engaged, because studying is work. It is just flat work, but we're going to give you tips to do that. But I want to make sure you caught this concept before we wrap it up. High growth fraction cells. Right there it says healthy high growth fraction cells. So we're very particular about the titles we put on slides to help you grasp those main concepts. These are the 5 areas in your body where you have high growth fraction cells. Now, cytotoxic chemotherapy drugs will kill high growth fraction cells indiscriminately. So why did I have you memorize these 5 areas of high growth fraction cells? Because this is where you have the biggest side effects, the ones that you're likely to see on NCLEX. So understanding why you're learning information, why do I need to know where the 5 areas are for high growth fraction cells? How will it keep my patient safe? Well, because I know it goes after that GI tract, I know I'm going to have fluid and electrolyte. I know I'm going to have nutritional deficiencies because they're not going to want to eat because it's so painful. I know with bone marrow, they're going to be at risk for infection. So what are all the things I know about someone who's really at risk for infection? Well, they can't have a beverage uncovered for more than an hour. They can't reuse a glass, right? They shouldn't be digging around with their hands in the dirt. They shouldn't have fresh fruit. Things should be canned. All those things we know for neutropenic precautions. So if you start playing a game with yourself saying, oh, instead of just having to learn this, ask yourself, hey, why would I need to know this? How would it keep a patient safe? It will make much more fun. You'll have much, much, much more fun. Now, this one, where we talked about the study as you go method, here, when I said, try to remember the toxicities we just discussed, I encourage you, write those out. Again, not trying to be bossy or telling you what to do. I know you want your lives back after nursing school, but we just want to help you get over this hurdle. Now, reading something and copying it is not really good processing for your brain, but the mental gymnastics that your brain goes through to say like, ooh, can I remember? That's pause and recall, and you are putting information in your brain in a way that you will be able to retrieve it. So go get them, right? Stop, pause, recall, think, then decide what you write down. Bing, 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 bing. That is gold. And that's what we want you to do to be able to be successful. All right. You are ready for day 2. So tomorrow you'll be looking at all the endocrine stuff. So we're talking about football with corticosteroids, diabetes, DKA, and HHNSA. Look at that. Free for you in the pharmacology review. So this is a pretty big section tomorrow. Good luck on that as you go through it. Let me know if you have questions, and I will see you tomorrow, right, for day 2, 7 p.m. right here. Now, I saw I missed a question. That's a really good question, Cole. I will send that back to you. If cisplatin is ototoxic and nephrotoxic, why wouldn't swelling in the feet or legs be important? Really good, very good question. So, Cole, I'm going to send you back an answer to your email. Got it? All right, cool. So any other questions, you can direct message me. You can email me. You've got my email, and I will make sure we get those sent to you. All right, guys, good night, and we'll see you tomorrow. Bye. Oh, thank you. I enjoyed having you tonight.